Well, doctors say there's been a decline in breast cancer screening since the pandemic simply because so many people have either canceled or postponed. But our Kenesha Dees tells us a safe way to do it during the pandemic.
This year, the Breast Cancer Research Foundation reports a significant decline in breast cancer diagnosis, close to 52% in the U.S. from March 1st to April 18th.
Since then, we have been able to readily accommodate each of these patients who have called and requested to have that examination moved until May, June, July, and up until now.
However, Huntsville Madison Hospital Breast Center Medical Director Dr. Libby Schattinger says that she's hoping the numbers of screenings this year remain consistent as they have in the past.
I'd like to be a little ahead, which means that we have more people being screened every year than we had the year before. I'm not 100% convinced that will happen in 2020. Maybe it will, or maybe it won't.
Schattinger encourages people to get screened. Early detection is key. Some of the concerns with delayed screenings include advanced stages of breast cancer.
But the estimate of extra breast and colon cancer deaths over the next 10 years is an extra 10,000. So it's important to just continue getting these screening examinations.
Schattinger says women in good health should start getting their mammograms at age 40. And for those who may still be nervous about getting screened during the pandemic, Schattinger says the hospital has taken extra precaution.
Here at the Huntsville Hospital Breast Center, when we have screening mammograms, the patients are still doing curbside check-in. We still have masking for patients, and for staffing, we check temperatures. We clean, of course, between patients. We've distanced our waiting rooms more so than we did in the past.
And doctors recommend women in good health to get their mammograms done annually. Putting the Valley first, Kenesha Dees, WZDX News.